Hi there, Kim Loh here again. Today, we are shedding light on some puzzling clouds around cervical cancer, helping you see the clear fact. Imagine this myth as foggy glasses that blur your vision. It's time to wipe them clean and uncover the truth. Here are 5 common cervical cancer myths that need to be dispelled. Myth number 1. Cervical cancer only affects older women. You might think that cervical cancer is something only older women need to worry about, but that's not the full picture. While the risk of cervical cancer does increase with age, it's a misconception that belief is limited to older ladies. It can strike at any age, even in your 30s and 40s. Just like flowers can surprise us by blooming at any time of the year, cervical cancer can affect women of all ages. Why this matters? Cervical cancer is often linked to a virus called Hpv, which can be contracted at any age. Regular checkups with pap smear and Hpv tests are important because they can detect early signs of the disease regardless of your age. Vaccines against Hpv are available, mostly given during the teenage years, and they are significantly reduce your risk of cervical cancer in the future. It is important to know that age is just one factor. Other things like smoking, a weak immune system, and certain behavior can also increase your risk. Remember, cervical cancer is highly treatable when found early. Don't believe the myth that only affects older women. Regular health checkups, awareness of risk factors, and vaccination can help protect women at all ages from this disease. So, just as flowers can bloom unexpectedly, cervical cancer can happen at any time in life. Stay proactive about your health, no matter how old you are. Myth number 2. Cervical cancer has clear symptoms. Well, that's not the case. It's a bit like expecting a fire alarm to ring loudly when there's just a small spark. The truth is, cervical cancer can be sneaky, and its symptoms might not be big and loud. Instead, they can be not very noticeable, like bleeding after sex or change in discharge. There are 3 things you need to know. First, not always easy to spot. Cervical cancer doesn't always come with clear signs and scream danger. Sometimes the signs are more like a quiet message. This means you might not realize that something's wrong until it's more serious. Second, listen to your body. Pay attention to what your body is telling you. If you notice any unusual like breathing after sex or strange change in your vinegar discharge, it's important to take it seriously. These little signals can be your body's way of saying, hey, something's up. Third, early checkups are key. Since cervical cancer can be tricky to detect based on the symptoms alone, it's crucial to have regular checkups with your doctor. They can do tests that catch issues early when they are easiest to treat. So keep in mind that cervical cancer doesn't always announce itself with big flashing signs. It's more like a quiet message, and sometimes it's as understood as a small spark that doesn't trigger the fire alarm. But it's still essential to pay attention. If you notice anything unusual, don't wait. Talk to your doctor and keep it up with those regular checkups to stay on the top of your health. Myth number 3. There's no way to prevent cervical cancer. Do you believe that cervical cancer can't be avoided? Well, that's not true. It's a bit like thinking a locked door can't be opened, but you do have the means to prevent it. Here's how. Hpv vaccination. Getting vaccinated against Hpv, human papilloma virus, is a crucial step. HPV vaccination. Getting vaccinated against Hpv, human papilloma virus, is a crucial step. HPV is a virus linked to cervical cancer, and the vaccine can protect you from certain type of HPV. Regular checkups. Visiting your doctor for regular checkups is another key. This checkup can detect any issues early on when they are easier to treat. Healthy choices. Making smart choices for your health is like having extra keys to prevention. Avoiding smoking and practicing safe sex can significantly reduce your risk. By taking these steps, you are actively preventing cervical cancer, much like using an umbrella to stay dry in the rain. So remember, you are not powerless against cervical cancer, and you have the tools to lower your risk and protect your health. Myth number 4. Cervical cancer screening are painful. Have you ever scared of getting a cervical cancer screening because you thought it would hurt a lot? Well, that's not quite true. Think of it, it's like imagining a small hill when you thought it was a huge mountain. While it might be a bit of uncomfortable, it's not meant to be painful experience. Here's the deal, not painful, just uncomfortable. Cervical cancer screenings, like pap smear, are not meant to be painful. They might feel strange or a bit of uncomfortable, but that's it. It's not like some painful experience you might imagine. Speak up if you are uncomfortable. If you do feel uncomfortable during the screening, don't be afraid to tell your healthcare provider. They can make adjustments to make it easier for you. It's quick and important. Remember, the whole process is usually over in few minutes, and it's a crucial way to detect any issues earliest when they are easiest to treat. So, don't let the fears of pain keep you from getting a cervical cancer screening. It's more like a small bump on the road, not a big mountain. And if it's uncomfortable, don't hesitate to tell your health provider no. It's all about taking care of your health in the way that's not just noticeable as a shock, but just as important. Myth number 5. An abnormal result means cancer. Are you concerned that abnormal result from a cervical cancer screening indicate you have cancer? Well, it's important to understand that it isn't always the case. Imagine it's like seeing a cloud in the sky and immediately assume it will turn into a thunderstorm every time. An abnormal result doesn't automatically mean cancer. It signifies that there are changes in your cervical cells. Sometimes, this change returns to normal without intervention, while another times they might require further medical attention. It's similar to assuming that every puzzle pieces must be in place to see the complete picture. Here's the crucial information. Not always cancer. An abnormal result serves as a signal that something is different in your cervical cells, but it doesn't imply cancer. Your body might even resolve this change on its own. Types of abnormalities. Abnormal results can vary in severities, ranking from mild to more concerning. Mild abnormalities often resolve spontaneously, while moderate or severe ones may require further investigation and potential treatment. Nevertheless, even these cases is not guaranteed cancer diagnosis. Medical follow-up. Healthcare providers may recommend follow-up tests or treatments in certain situations to ensure your well-being. However, this doesn't automatically indicate cancer. These follow-up steps are essential for early detection and successful management of potential issues. So, an abnormal result in a cervical cancer screening doesn't necessarily translate to cancer. Your health provider will guide you through the process and help you understand the situation. The key is to monitor your health with regular screenings and follow-up care, as it's allowed for early detection and effective management of any concerns that may arise. Cervical cancer is like a problem that can happen in a part of a woman's body called the cervix. Think of cervix as a gateway between the vagina and the womb. Sometimes, if something goes wrong with the cells in the cervix, they can start to grow in a harmful way. These cells might form a lump or growth called tumor, which can be cancerous. This kind of cancer can be serious, but the good news is that if caught early, it's often treatable. That's why doctors recommend regular checkups and screenings for women to make sure everything is okay down there. So, cervical cancer is a condition that can affect the cervix, but with proper care and early detection, it can be managed and treated. Before you go, like, subscribe, and share. Thank you for joining me today. Before we wrap up, tap that like button, subscribe for more informative content, and share this video with your friends and family. Let's spread knowledge, erase myths, and shine light on the truth. Until next time, stay informed, stay healthy, and keep uncovering the facts.